Down syndrome. Now, this is the commonest query amongst the couples because a lot of screening is directed towards it. And let's understand what is this uh, exactly. Okay, so Down syndrome is a chromosomal problem or an aneuploidy where instead of two 21 number chromosomes, there is one more extra 21st chromosome. That makes it a trisomy 21. That is Down syndrome. Now, we know that an individual is made up of 23 pairs of chromosomes, which makes it a total of 46 chromosomes. The commonest problem which happens when a baby is being formed, when the fetus is being formed due to constant replication of the cells, is the trisomy 21. There are other problems as well, like trisomy 18, trisomy 13, and many other aneuploidies can happen, but they are less common. And the commonest being this, we need to do a lot of screening to diagnose this. Now, for Down syndrome individuals, there are specific facial characteristics like slanting eyes or slanting palpebral fissures, which we call them, or there's a flat face. So, this typical facial feature amongst all of the individuals who have Down syndrome is something which is strikingly similar. And even if we search this on Google Media, we'll get the striking similarity. So these individuals might not have severe structural disabilities or abnormalities. Few of these fetuses might have cardiac defects. Most of these individuals might have later learning difficulties or intellectual disabilities. They might have hearing problems. So these kind of problems these individuals encounter, that makes them slightly dependent on the caregivers for the entire life. And these individuals will live through the life, through their second decade, third decade, even fourth decade. So, when we diagnose the Down syndrome, the commonest query among the couples is, can we change this? Is there any injection? Is there any medicine which can be given and can be used to treat this problem? So, the clear answer is no. We cannot really treat this or change the chromosomal problem, but we can diagnose this prenatally. And how is it going to help us? It will just help us making an informed decision whether we want to continue this pregnancy or otherwise. Now, that's an individual decision which we all support, but giving the information is important. Now, Down syndrome is, as we have discussed, that it's a 21st pair chromosome problem. And how are we going to diagnose or rather screen this? Now, we do the first trimester scan, that is the NT scan, which I have discussed in detail in my previous video, where we check for the nuchal translucency, the nasal bone, tricuspid regurgitation, ductus venosus, basically for markers. We're searching for high-risk markers on scan. If we find anything which is high-risk on scan, then we go on to do further testing, and we also supplement this with further blood tests like double marker tests, where we check two hormones. We also check for NIPT, that is the non-invasive prenatal test. Now, this is a mother's blood which is taken, and then we assess through the cell-free fetal DNA, and we search for the now this gives us a 99% sensitivity for assessing the risk of Down syndrome. If we get a high risk, then we further go on to do a definitive test. That is an invasive test, which is chorion-villus biopsy or amniocentesis. And then we will further 100% diagnose whether the Down syndrome is present or not. Now, if this is there, we definitely can't change it, but we give this diagnosis to the couple and then they can decide the future. Now, United Nations has declared 21st March to honor the individuals with Down syndrome, to give them a certain recognition for their inclusion in the society. And because there's a lot of, the knowledge needs to be spread about these individuals, and that is why 21st March is celebrated as Down syndrome. So this was all about it. I hope it helps solve all your queries.